Welcome, everybody. Welcome back to another fabulous episode of Healthcare Trailblazers. I am very happy to be sitting here today with a good friend of mine, Dan Godla. Dan is not only a good friend, but a really interesting entrepreneur. Dan is the CEO of ThoroughCare. ThoroughCare is a really interesting company that we use, and Dan grew ThoroughCare. He's the CEO and founder. He grew ThoroughCare to about $4 million in revenue, and they're just getting started, trust me. And they also hit the Inc. 5000 list of fastest growing companies last year. So they're really going in a really cool direction. Dan, thanks so much for taking the time and stopping by.
Mandel, thank you for having me. Great to be here.
Absolutely. So, all right, this is what we like to do on the podcast is take a step back. Let's talk about how'd you get started. Did you have so ThoroughCare? Tell us a little bit about what it is, and then we'll get into kind of how you got started.
Yeah, so at a high level, we're a web-based software company. We help doctors and groups that support doctors to manage patients by providing tools that otherwise they wouldn't have as part of their electronic health records. And there's a lot of programs that doctors should be doing. The staff is eager to do them. The patients want to receive the services, but they don't know how to do it. So they're trying on spreadsheets or other pretty awful software. And we give them tools that make it easy. So we're kind of known for clinician-friendly software, really easy to use. And we help these doctors to provide new services. And doctors, let's face it, they're busy people. They don't have time to do this stuff. And technology is probably on the last thing they're thinking of. And so, we want to give them a way that their staff can be efficient and they can add some more revenue to their practice while helping their patients. So that's kind of what we do today. Wasn't originally that way, but we've kind of found a niche in that type of solution for doctors.
Well, that's really great, and cannot be understated how important that is to doctors and how busy they are, and how taking the busy work out of their life and making things more friendlier for them is amazing. I literally just before our podcast session here, I got off a call with a doctor, and he was saying how he's got like $250,000 worth of claims that are just waiting to be submitted, and it'll take him like 5 hours, but he just does not have the time. It's crazy. So the tools that you've created, we use them every single day, and they really are incredible, and they really are very doctor friendly and busy friendly, and it's really an amazing platform. So how'd you get started?
So my first entry into healthcare was about 2005. I worked for a healthcare software company, more on the payer side, but I got to work closely with doctors and nurses, and they did really great work. They wrote good content, and we had to put it in some software that, let's just say, it wasn't very user-friendly. And so I was, the tech guy supporting that group, and it just got me thinking there's got to be a better way to do this. And so around 2013, the scenario was right for me to start a company to try to find a better way to do this. We started as a patient assessment tool, and if you think about it, that's still an area that's pen and paper today. You go to your doctor, what do they give you? That big clipboard. Yep. So we thought, well, why don't we automate that? You could do so many things electronically. Why don't you do that before you come in, or even in the waiting room on a tablet or something like that? So we built out a patient assessment tool. It allowed the doctor and the care manager to ask important questions to the patients, things that they might not know the answer to, but by knowing the answer to certain questions, you can make clinical decisions. And so we thought, based on the answers, we can analyze some risk factors and maybe use some logic to predict things that should be done. Built out that version of the product. When I started ThoroughCare, I joined an accelerator program. This one was in South Carolina called the Iron Yard. And for those who aren't familiar with accelerator programs, you spend a couple months with the program. You have speakers, you have mentors, and so if you need help, you have lawyers that can help you, and marketing team, and finance people. So you get that support system around you. So we did that program, and then at the end of the program, the goal was to have a beta product that you could actually show to clients who would start using it. And the best type of revenue is paying customers. So is anyone willing to pay? Yeah. So that's kind of how we got off the ground. Almost 9 years ago. It's hard to think about it, but
does it feel like a million years ago, or does it feel like yesterday?
It seems like a long time ago. We've had anyone who's ever started a company, it's never
Yeah.
easy. It's when you start, you think it's gonna go smoothly, but I think everyone has some bumps in the road, and we had some throughout the years, but we've gotten to the place now where our software has evolved into something that we think people are willing to buy because it adds significant value. We see how it helps patients. That's really the
Yep.
important part. But fast forward to today, I think our product has uh, become something that is important to the day-to-day operations of a
Yeah.
practice.
So when it comes to starting any kind of business, and I think specifically when it comes to technology, I feel like a challenge that probably a lot of people face is they've got this vision of what they want their service, their product, but specifically technology to look like. And then, but it's really expensive and it takes a lot of resources to build typically that vision. How did you go about navigating that and
Yep.
being able to kind of focus on the immediate steps to create that MVP product, and not get stuck in going for perfection or going for the big thing, but actually just getting started and then taking it from there?
Yeah, what's the saying? Perfection is the enemy
Yep.
of success. If you try to make it perfect, it'll never happen. And so early on, we kind of did a crazy thing where we talked to nurses and doctors and we showed them the software. What do you like about it? What do you hate about it? And we got things like, I don't know how to access this screen. And we watched them use the software. Okay, well, maybe the place we put that button's in the wrong place. And then a feature we thought was really important, no one ever used. So you talking to the customers, as crazy as it sounds, is helpful when you're trying to build out a thing like that. And you'll find pain points. And we discovered this along the way. We built an assessment tool to start, but then we found out, hey, chronic care management, this is that new program that came out. I don't know how to do that. I have to log my time. Okay, well, what if we had a timer that allowed you to do that? And what if we created all those reports you need to submit too? So we started talking to clients, and honestly, a lot of the features that we built out today came from users that said, if you did this, I would be so much more efficient. But you have to make sure that you do that safely, because you'll also get things that might take you down a path that maybe wouldn't help all of your clients. So it's important to look at these requests and say, yeah, this one would really add value to the platform. This one might be a nice to have. Maybe I'll do that one later. And so in the early days, I took a lot. As any founder, you wear a lot of hats. So I did a lot of that. My background was MIS, so I've done some requirements gathering on the business side and the IT side. But then we started to have, as we grew, we hired people that manage our product team now. So we have a product roadmap, and there's things on our wish list that we want to build, but it's important to make sure the core functionality of any software platform is helpful to the users. It makes their job easier. That's really the goal, and I think that's why we've been successful, particularly in the last couple of years. It's because the software is helpful to people. If it's not, they'll
Yeah,
stop using it.
as a fan and user, I can definitely say that you've continued that mindset, and you're constantly asking your users for their feedback and using that to kind of go forward. So that's really interesting. What are some other challenges? Because it really is a very interesting success story, I think. To go from $0 to $4 million in revenue is huge, and always the 0 to 1 million, let alone 4, is so much harder than, God willing, you'll be at 50, 100 in the coming years. But the first part is really when you're in
Yeah.
the trenches, that's really difficult. What are some of the other challenges that you came across? And in hindsight, how did you go about overcoming those challenges?
Yeah, in all honesty, our very first product that we built, we got really good feedback from doctors. They said, "Yeah, that's great. That would help my practice." And then we said, "Well, what would you pay for that?" And oh, I wouldn't
Right.
pay for it. And so we got feedback like that, and everyone liked our product, but no one wanted to buy it. And for a startup, the customer validation is critical. Asking your clients, all right, if I built this, would you use it? But is this something you'd be willing to pay for? And that was a hard lesson learned early on when we were so excited with the product we had, and we just couldn't get doctors to buy it. But the thing that turned it around for us is we found a niche in the Medicare side. So this is an area that, by talking to doctors, we found out they were struggling in this area, because a lot of the EHRs, most doctors have one today, they don't do a lot of the things, the wellness programs, the care management programs. And so we had our assessment product, but then we went to the doctors and said, well, what if it help you to do all these things, then would you pay for it? And they said, yeah. And ironically enough, the product that we ended up building allows our clients to generate revenue. So these are things that otherwise they would miss out on, but by using our software, they're making money for their practice. And that was a big pivot for us, that we went from a software that saved them time and was nice, but the making them money part really allowed us to close deals. So until that, and that took a couple years to get to that phase, but early on, I wish I would have asked the questions, is this something you'd be willing to pay for? And we might have pivoted, as any startup does, much early on.
That's smart. That's great. Yeah, absolutely. We're both in the same space. For those so Dan has this incredible technology platform, and then our company, for those that don't know, we stack on top of that the clinical team to implement the service from A to Z. So we work together quite a bit, and I have to say, it is such a, people have this misconception that doctors are swimming in cash and they're just balling and they're rolling it in and they're doing great. And it's really not the case. It's really, really not the case. To find a doctor that is both a doctor and a successful business person is really, it's a unicorn. It's really, really rare. And doctors need a lot of help, and they're not swimming in cash. So in a previous part of my life, something that I did was also in healthcare, but I was trying to sell a service to doctors where it was like, hey, here's this incredible service, and all it's going to cost you is X amount of money. And it just didn't feel good. It didn't feel right that you're coming to these doctors and you have to convince them to take their limited resources and take a chunk of it and give it to you because you've got the best service. And I think what's so nice about what you've built and what's allowed businesses like mine to flourish as well is that we're not asking for doctors for anything. It's, hey, this is going to enable you to really make a lot, to make more money, and that just the sale, it feels good because it's really valuable. Nothing feels better than when you're actually providing value. And I think what you've built is amazing in that sense, because it really does provide value to a lot of doctors.
I appreciate that. Yeah. And you're exactly right about doctors, especially independent doctors that own their own practice or clinic. And maybe they've been in this business for 20, 30 years, and now they have a staff to pay at higher wages. They have insurance. They have the office rent. And COVID, in all honesty, it hurt a lot of doctors. Patients weren't coming in for their regular appointments. And a lot of these chronic conditions, these patients were being seen once a month. So they went through a whole period where your normal appointments and your surgeries were just put on hold. So, any program like this that can help a doctor. We've talked to practices that said, these care management programs and wellness programs, they saved us during the pandemic because they allowed us to stay engaged with our patient population when otherwise they weren't coming into the clinic.
So at what point in the business, first of all, talk to us about the beginning. Let's do the beginning and the middle. So you start a company. You don't necessarily know where it's going to go. You're hopeful, obviously. There's probably a lot of uncertainty in the beginning. What was that like? And then at what point was there like that aha moment, like that switch, like, oh, I think we're onto something?
Yeah. And every entrepreneur will tell you that they've probably had days where you say, what am I doing? I should just get a real job. And early on, I've had many of those where you try to get something built and it's just, you're running out of money. I went into my savings. I sold my house. It could have, been a bad decision, but I felt like we were so close early on that if we just got through a certain hurdle that would be on a good side. And we definitely had bumps in the road, but trying to get a product built out. Once we found a niche where, okay, seems to be a need for that, then we needed developers. And developers aren't cheap, especially if you want good ones. And then building out that team. And then and then we were like 3 or 4 employees. And then you realize, geez, this thing, I have people now depending on this to be a success, to feed their families. And that's a scary thing if you've never done it before, where the company success is, kind of on my shoulders. And we've hired great employees through the years. And I think getting that product built, getting it to the point where we listened to our customers, we had a solution that everyone wanted. I think, staying strong to that helped us to grow. And then we started growing by word of mouth. So one doctor would tell, doctors are friends with each other, right? They're at the hospital, say, hey, I'm doing this care management program. I'm making about $5,000 a month. Oh, really? Well, what do you use? ThoroughCare. And then, we started to get our early clients like that. But we went years without a sales team. It was word of mouth. It was search engines. And then I think the other area as an entrepreneur is that when you don't have enough money to staff departments, I was the marketing department, and then I was doing payroll. I still am involved in payroll. So like, there's so many tasks as a founder, until you do have that ability to build out the team. So I think, just sticking through it, knowing that, yeah, there is something good on the other side, that we believe strongly in the product, that if we held strong and saw it through, that would get some good results in the end.
Yeah, absolutely. I've been talking about this a lot recently, but just the power of time and trusting the process. And what's so fascinating, I think, about it is, what you typically think is like, okay, things take time, and it is what it is. But if I just do this task, for the next 5 years or whatever it is, I'm going to be successful at some point. But it's really a lot more powerful than that, because I think people don't really appreciate the almost exponential growth quality that time has. And when you're starting out, you cannot foresee the steps that you'll be taking in 5 years, because those steps will be direct results of the previous steps that you have taken that ripple, effect all the way back to your small little steps today. So I think exactly, the roadmap that in hindsight that you took, which I think is really great. You start something, as long as you've got the right fundamentals, you're listening to your customers, you're asking them questions, you're pivoting accordingly. You're not getting caught up in what you think the result should be, but rather what your customers really want. Just trust the process, stick with it. You said 9 years, but I mean, look at it today. And honestly, you really, I think you're just getting started,
Yeah, I appreciate that. In the early days, it's always fun when you pitch to investors and you have to lay out your 5-year plan. I mean, seeing past a year or two is often a challenge.
Yeah.
But especially as you're getting started, you'll have, things will change, priorities will change. The core business of the company is probably still the same, but you've got a lot to get through. But that customer validation, I go back to that. I think that's the most important thing, is that, are we really building something that's valuable? And if you're not, pivot and find something that, is in the right spot, or something you're good at. And very easy to get sidetracked as a startup. We've kind of explored, do we get into clinical services? And, we thought, oh, let's hire nurses and we'll manage it. And we looked at it and said, hey, look, we're a software company.
Right.
I have enough trouble managing developers. Now I want to manage nurses. I'm not a clinician, right? And so, we leave that up to the doctor. We leave that up to groups like yours, Mendel, where, hey, you have clinical team,
Yep.
but you don't have software. So use our software. We'll leave it to your nurses and your clinical staff. So, that was tempting that, hey, do we want to go down that path? And at the end of the day, we said no. So let's just be a software company.
Yeah, and it's a really important and freeing realization once you get that clarity of exactly what you do. And it's so funny that you say that, because on every call that I have, I say the exact opposite. I say, let me, here, who are you as a company? We are a people company. We are not a technology company. And also, we've had conversations where we've looked at technologies and different things, and same that made the exact decision on the flip side of the coin. And it's a very it's a very freeing realization, because it allows you to hone in on and focus in on your strengths and develop that, and understand where to partner with the right partners on the other side. Yeah. So you hit the Inc. 5000 list of fastest growing companies. That was last year. You are at a really, really nice number in revenue. Where do you what are your goals? Where do you see yourself going? How big is the team? What are your metrics of growth and success?
Yeah, so it took us definitely a while to get to this point where we're cash flow positive, and we had the ability to take that, invest it back in the company. We tried to raise funding for years, and COVID didn't make that any easier. We did some family and friends rounds in the beginning. That's what a lot of groups do to get started, and convertible notes. And when we moved here to Pittsburgh, where we're located, we had some funding from some of the local groups that they want you to create jobs in the city. But for the most part, we hadn't raised a major round. So, the investor pitches, that's something that we tried. We did some of it, but we felt we really didn't need it in the early days. We recently closed a fundraising round. We called it a Series A, and that was really to set the company in a new direction where really sets us well to growth. So we got to this point without a sales team.
Wow.
And now we'll have 10 sales reps, things like that. So we're building out parts of the organization that really haven't had proper staffing and proper management. So we've hired some VPs on the sales and the product side. We now have a customer success team that will have account reps that all of our customers have a go-to contact. In the early days, that was me for every customer.
Right.
So we're about 600 clinics, so it can't be
It's a little difficult
anymore. But we're kind of going out of the startup phase. I still call us a startup, but we're building the organizations that a lot of companies have. So excited to have an in-house support team and a product team and a sales team. We have marketing team now that they do great videos and articles and things like that. So getting to that next step, I think as we're staffed appropriately, that sets us up well to grow. We know that the product is something that people want, something that people find valuable. Now, how do we scale that thing? And we haven't finished building it too. It's always going to grow. We have a roadmap of things that we want to do. The healthcare industry, as you know, it's always growing, and there's new demands. There's new programs coming out. Medicare, particularly, they update their program list every year, and we try to stay on top of that. And there's a lot of telehealth now and remote monitoring, things that weren't even talked about too much in previous years. So we want to stay on top of the latest trends, make sure that we have the tech support and the developers to stay on top of that. But lots more to come in new products and enhancements. We did some analytics and reporting. So it's exciting to finally be able to do that. A lot of times we build out things that are requests, but now we're trying to look ahead. Where's healthcare in a couple of years? How do we make sure the software is in line with what other groups are doing? So yeah, that's the fun part of running a company, is now that we do have a little bit of funding, we can plan appropriately, we can make sure we grow. But yeah, good stuff to come for sure.
Very exciting. Let's talk about content a little bit, because for years you've been creating really interesting pieces of content, written videos, articles, etc. And it seems that, looking back, even when you were the one wearing all the hats, and even though you're the tech, you're a techie guy, you've got the tech background, but it seems that you realize the importance of content creation, and you've kind of kept that consistent. And so if you can talk a little bit about what made you realize that, and the successes that you've seen come through the content that you put out.
Yeah, it's probably one of the best things we did early on. We had a decision to make. We don't have sales reps. How do we get people to our site? And so we knew that when they called us, we knew the types of questions they were asking. And we worked with a marketing team out of Connecticut called Impact, and they call it inbound marketing. And their big push is, they ask you answer, that any question you ever get from a customer or a lead or a prospect, have an article for, have a video for. So we did a lot of work in the Medicare programs, and we knew that if they didn't know about them, they were going to say, how does this program work? So sure enough, we have an article. Hey, here's how chronic care management works. How does remote patient monitoring? And it's not even about the programs, but I'm a small practice, and I want to get started. How do I explain this to my biller? Here's an article on that. How do I hire a care manager? So we have over 100 articles today. We finally hired a full-time content writer, and he's pushing out 2 to 3 articles a week. So the content's fresh, and that's good for anyone who, they always say, what, an educated buyer is the best kind, because by the time they talk to us, they've done their research, and it's really anything you buy. I was just building a fence in my yard for my dog. I did all this research, so by the time I talked to a contractor, I knew the material I wanted, the type. So it's the same thing with healthcare. Doctors are, they've heard about these programs, they know they should be doing them, they're just not sure how, and that's where we come in, and here's how. So the content writing it was a great move on our part, and the other thing, search engines like it too. So Google and Bing, and they like sites that update frequently and have good articles. So, very frequently we'll be at the top of a search result for one of our programs, or how do I get started with, we're up there at the searches. So I'd recommend that to anyone. It's a lot cheaper than hiring a sales rep to go out and find leads. Let them come to you, and that's that whole concept of inbound marketing. Get people to come to your website, and then they can talk to you, and you'd be surprised once they read some articles that the leads that read I think 3 or 4 more articles, they're more likely to buy. So a lot of good science behind
Yeah,
that too.
yeah, that's a great tip. So, being that you've listened to your customers successfully for so long, and you've created a lot of content focused on questions that they're asking, let's talk a little bit about where healthcare is going. And I think the shift to value-based care, and how a lot of things that you're doing is supporting that shift. So what is for those that are unfamiliar, first let's talk about what does value-based care mean to you, and then we'll get into kind of maybe some tips and tricks for doctors.
Yeah, so for the longest time, going back to, 30, 40, 50 years ago, a doctor would get paid when they do something. So I go in for an appointment, the doctor bills the insurance company or Medicare. I get a surgery, the doctor bills for that. So the landscape is changing where instead of paying a doctor for every service they provide, they can get incentives for keeping the patient healthy. So you keep the patient out of the hospital, you get an incentive payment. And there's many different incentive structures. Doctors should, find one that works for them. But it changes things, right? You don't need to, bill for 1 million services when the goal is to keep the patient healthy. So a lot of these programs that that we're really pushing towards the doctors are things to be preventive and wellness programs. And let's try these steps to keep the patient out of the hospital. So the concept of a care manager and where your team fits in. So your care managers call the patient every week, or they check in with them frequently throughout the month. How's everything going? I noticed your blood pressure numbers were high. It's a way to extend the doctor's reach to the patient to keep them out of the hospital. And if that doctor proves that the patient is healthy, are we lowering our healthcare costs? So that's really the shift. It's by keeping the patient out of the hospital where it's very expensive. We'll incentivize the providers for keeping them healthy. So it's a great thing for the patients. I think every patient would rather, spend a couple hours a month, talking to someone that's updating their care plan than spend days in the emergency room in the hospital. And the money behind this, it's been proven to work that by spending on preventive care and wellness, the long-term healthcare costs go down, which means the patient's healthier over time. So that's the exciting part. The patient's the real, winner in this landscape. But the doctors who do it right are the ones that really can make a lot of revenue out of it. And like I mentioned earlier, these independent practices, they're struggling on this because they're not really sure how to do it. So that's where companies like ours, we talk to doctors. It's like these programs, they pay for themselves, first of all, but then you get your value-based care metrics. So you hit your quality scores, and then you get incentive reimbursement. So right now, these value-based care programs are optional, but in a couple of years from now, doctors are going to be required to do it. And so there's never been a better time for a provider to start looking into doing these.
And it really is, I think, when done right, which is obviously the key, it really is super nice for both the doctors and the patients. Because on the doctor side of things, you kind of get out of the rat race of just nonstop doing things to be able to keep your practice, above the water. And kind of going back to just being a doctor, like being a care provider, because you can take away a lot of the things that you don't need to do where previously you needed to do just to bill for them, and just focus on keeping your patients healthy. And the patients that that really need attention are able to get your attention. And for the patients, absolutely. I think like the most interesting contrast is in a fee for service, in a value-based care world, the things that you make money most on in a fee-for-service world are the things that you lose the most on in a value-based care world. So like in a fee-for-service world, if your patient needs to have a hip surgery, you're making a ton of money. You're doing that surgery. But in a value-based care world, if you're taking really responsibility for that patient's care, and now you have to pay for that. So if you, so a simple thing, that a lot of the assessments that your platform does is a good example. Like just when you have a chronic care management program or something like that, where you're checking in with your patients, and let's say that you're talking to your patients, you have a relationship with them, and you understand that they don't have a safe environment. They're older, and there's no bar in their shower, or their environment isn't physically safe for them. And then you go ahead and coordinate so that gets fixed. And now that patient just did not slip and fall and break their hip, and now you avoided that that surgery that would be very costly for you in a value-based care world. So I think a lot of the tools that you're
Right.
building obviously are more geared towards helping doctors move over into that field.
Yeah, and there is some crossover too, like chronic care management and RPM. You get paid
Yep.
on those services too. So they're kind of fee for service, but they have a direct link to the value based side too. So I think these programs are a no brainer to doctors because it's you get the benefits of both worlds. We do have some groups that use ThoroughCare, and they don't see Medicare patients, but they use the care management programs just to help the doctor. So I never thought I'd see that day where we have clients that use it just for the good of the patients, and they know that by keeping my patient healthy, there's long-term benefits to that. So that's an exciting trend in the industry, Mandel. I hope it continues, and from everything we've seen, it
Yeah.
looks like it will.
So let's talk about those clients for a bit, because I would imagine a lot of ACOs are starting to more and more use services like yours, and the ACOs have. So you tell me what's the benefit for an accountable care organization to not get paid necessarily, not bill insurance for the programs, and yet to implement them anyway?
Yeah, so for those who aren't familiar, an ACO is really a physician's group. So a lot of the things we do, a doctor can do on their own, but an ACO is a group of physicians, and you could save costs on administration. And if you're going to hire nurses, well, I don't need one nurse myself, but maybe the ACO. So it's a group together, and then you can kind of share resources, and you get reimbursements a little differently. ACOs get what's called shared savings, and it's based on how well you do. There's kind of a scorecard that you have to make sure you check all these things off, and every year they get ranked. But shared savings payments can be in the millions of dollars, and so doctors, many of them are starting to look for an ACO in their area, and there's many across the country. Some are regional based, some are specialty based. So certain specialists have a different kind, but that's one of the types of value-based care programs, and they're starting to pop up more and more. If you're a patient, you might not even know that your doctor's a part of one, but it's nice to see that as a way that doctors can do these things. And like you said, they're busy, so they let the ACO manage a lot of these things while the doctors practice medicine.
So I think one of the newer programs that you have is just the care coordination program, not the chronic care management program, right? So how does that work for possibly a model where you don't necessarily have to, if I'm somebody that, let's say I'm an ACO and I don't need to be checking off every checkbox to bill for the, I don't necessarily need to be doing the 20 minutes. I don't necessarily have to build a specific care plan with all the specifications because I'm not billing insurance for it. How does that program help me versus the CCM model?
Yeah, so an ACO, they'll get what's called an attributed list of patients. So all the doctors there's some algorithms where you figure out your riskiest patients. So, maybe at a high level, they get, let's say, 10,000 patients that are high risk. So if they manage those high risk patients and keep them out of the hospital, they'll most likely hit shared savings and have a lot of benefits. They'll get higher reimbursements across the board for all payments. So the goal is to make sure your riskiest patients are managed. So they care less about, did I spend 20 minutes? And in a lot of situations, by the way, you could do both. You could do CCM and manage high-risk patients. But our care coordination model is kind of a variant off our chronic care management, where the goal is, do I have a touch point with every high-risk patient? And we allow you to stratify your patients in risk tiers. So maybe the high-risk patients get contacted a few times a month, and moderate maybe once a month. And maybe the lows are good the way they are. You just need an occasional check-in. So that's one way that we allow them to do that. But if the insurance covers it, we have many that bill for CCM as well.
So, I mean, you're at a really exciting space right now. I think, like you said, you're coming out of the startup phase, which is really amazing. What are some tips that you can give to other people that are trying to start out in a technology space or even business in general? You mentioned a couple of really great insights earlier about listening to your customers. Are there any other, I'm sure you've got some other gems from over the years that you can share?
Just try to learn as much as you can. So, my background was technical. I was not a clinician. I'm not a doctor or a nurse. So they have pain points that I was not aware of early on. And I wish on day one someone told me, okay, find out what's really bothering that doctor. Because the problem I set out to solve was not the thing that was the most important to them. And it took me a couple of years to find that. And geez, I feel like I could have saved a lot of time. But if you're building a solution, most likely you got the idea from something that was tedious to you or something that you've seen someone struggle with, and especially with technology. But just make sure that you have it all buttoned up and you have a good idea to start with, and you don't have to have it all the bells and whistles on day one. The startup word is what? MVP, minimum viable product. So what's the minimum you can build to go to market and get that initial feedback? Maybe get some early revenue. Are the customers willing to pay for it? So that customer validation early on, I think for any entrepreneur, do it as soon as you can, and try to save costs however you have in those early days. And if you feel strongly about your idea, stick with it. You'll hit some bumps in the road. For sure, but if you're doing the right thing, and especially in healthcare, healthcare is ripe for innovation. I can't even wait to see what it looks like 5 years from now. I mean, we could be looking at blockchain healthcare records. I mean, there's some crazy stuff out there that we have on our radar too. But a lot of exciting things that I think this industry is primed for innovation.
That's very cool. Okay, well, a step before that, let's I know there's other tools out there that utilize a lot of AI. What's your opinion on AI, specifically when it comes to your demographic of more senior patients? What's the relevance of it in your opinion, and the efficacy, I guess?
Yeah, I think it's good for decision making. If you could have AI help a doctor that would spend a lot of time analyzing things, I think that's good. But the actual interaction with the patient, I don't know. I'm kind of old school on this, where I think a care manager picking up the phone and having a conversation, and they just don't want to talk about their high blood pressure. They want to talk about their grandkid's soccer game, and the care team is that person that the care manager feel that they build a relationship. So I worry that if we go you got a robot calling grandma, are you getting the same care? Maybe, I don't know, but I think that these programs are successful because the patient feels comfortable talking to their care manager. These programs are very personable. And I think that's key. If the patient loses interest, they're going to opt out, and that's one of the rules with any of these programs. They can cancel at any time. So we've heard stories, and I think from some of your care managers too, that that call, they look forward to it every week. They can't wait to tell you what happened over the weekend, and they're going to be the one you go to when they have a healthcare issue too. So I hope that never goes away, but I think there's ways that technology can help, maybe behind the scenes. I'm very excited about that part too. But I don't think you should ever get rid of that personal touch, at least in my opinion.
Yeah, I absolutely agree with you. I think it has to be a happy marriage between the personal and the technology, and to your point, yeah. I mean, I get our care coordinators have stories every single day. Literally yesterday, one of my care coordinators was saying how one of the patients had to opt out because their insurance changed and no longer covered the program, and she was saying, she called as like a goodbye call almost. The patient called in and was saying how she's really going to miss. One of the things she mentioned was going back and forth about whether or not she should adopt a cat or not. So just very specific. I mean, we've had care coordinators sending. We've had patients sending. Like care baskets. The most memorable have been, like cookies and stuff. But the most memorable, we once had a patient who had sent homemade moonshine to the office.
Oh wow!
So they really do. It really is, the personal touch really is important, and in keeping that patient engaged. And like you said, the idea here is to empower the patient. The idea is to, if you're just going to talk at the patient, and this is kind of a recurring theme that we've talked about with a number of guests on the show, but if you're just talking at the patient and they just feel like they're being quizzed in the principal's office and they want to give the right answer to the doctor, the answer that the doctor wants to hear, then you're not really doing anything, because the patient's not going to give you a real answer. But to understand that the patient it's the patient's health at the end of the day. So they need to be a partner in
Right.
taking care of their health. So we got to figure out as humans how to really, on a human level, not just a technology level, but on a human level, how to really, talk to the patient in a meaningful way that's going to make them want to partner with you on keeping themselves healthy, which is
Right.
what's going to make our country better and healthier.
Yeah, there's that trust that I think it goes a long way between the patient and the care manager.
Yeah, absolutely. Well, Dan, thank you so much for taking the time today. I'm super excited to see you're obviously going in a great direction. I'm excited to check back in 5 years and see what kind of blockchain,
Of course. Yeah.
things you've got going on over at ThoroughCare. And I think there's there's clearly a lot of innovation happening, and ThoroughCare is really at the forefront, and it's really nice to see.
Yeah, thank you, Mando, and we appreciate the chance to tell our story, and we're excited to be working with you and your team. And I think there's a lot of good things to come in this industry and in healthcare as a whole.
Absolutely.
Good stuff.
Yep. Thank you.